Why do people think that violence should be referred to as a public health problem?
Well, when you look in public health and you think about what are the facets of disease and how we both intervene and try to prevent disease, violence very much fits a public health model. All people that are impacted by violence, both perpetrators and victims, have a negative impact on their health. Violence also is something that, if we view it in a public health model, can also be prevented and controlled with public health approaches. So it very much fits a model for a public health issue as opposed to a criminal justice issue. And that's mostly how we try to deal with violence right now. But we could actually bring public health approaches to bear that could prevent and reduce violence and the negative health consequences that it has on entire populations.
Similar to what we've done in other disease states. If we look at it as a disease, we start talking about cause, prevention, treatment, those entities. We can look at violence in the same way.
We can, and we've actually eradicated diseases in public health without even understanding the full etiology of it. You know, this issue comes up all the time. Well, what actually prompts violence? What's the root cause of violence? And different people will tell you different things, and I'm sure we're going to talk about that. But if you use a public health approach, you don't even have to actually per se address etiology. You can very much put it in a disease model. You can identify who's at risk for transmission of the disease, who's most at risk for being both a victim or a perpetrator of violence. And then you can intervene the same way you would if we were talking about an infectious disease like hepatitis or HIV.
Or polio, which we once eradicated in this country,
only
to see public health policy make it have a comeback. Sure, it's very interesting in terms of how these two things, how violence can mirror disease in a community like Detroit or Flint or any major city in this country. For more information about the show and our guests, visit our website at primarycare-tv.com and continue the conversation on Facebook and Twitter.